Hi, my name is André Fialho, and I'm a co-founder CEO at Pact Care. And with this video, I'd like to share more about our vision and progress. What we're looking for at this stage are more organizations interested in joining our proof of concept. In particular, we're looking for more partnerships with focus clinics, ZSAs, and peripheral hospitals here in the Netherlands. So let me start by sharing with you the story of Tim. Tim is a 55-year-old architect whose vision has started to worsen a bit lately, not allowing him to work. So he goes to his GP, who thinks he has cataract, and who, based on his experience, refers him to the nearest hospital with an eye department. Unfortunately, the waiting time for this consultation is 8 weeks. And what Tim nor his GP know is that at the neighborhood hospital, or ZBC, there's an available appointment in just 1 week. So they just accept the situation, which obviously affects Tim's quality of life, but also his professional activities, being an architect. But Tim is not the only one. In fact, in 2018, in the Netherlands alone, there were more than 2 million appointments where patients had to wait longer than what the Dutch Health Authority recommends. And as we speak, due to the ongoing coronavirus crisis, most non-urgent appointments and surgeries are being postponed. So the number of patients on a waiting list is currently growing very rapidly. To address this issue, insurance companies are now mandated to help these patients with excessive waiting times via what is called healthcare mediation service. This mediation service consists on each insurance company having a call center department in-house that employs several dozens of people, and when they receive a request for mediation from a patient, they then call different hospitals and different clinics trying to find an earlier alternative. And once they find this alternative, they then have to call back the patient to confirm if that appointment suits him or her. So as you can imagine, this is a very manual and labor-intensive work of back and forth calling. So Pact consists of a web-based platform that significantly speeds up the process of matching demand and supply for medical appointment time slots. On one hand, it can be used by providers to list what slots they have available and what clinical cases they want to focus on. On the other hand, insurance, in the name of their patients, can define the parameters of care that they're looking for. What medical specialty, what's the preferred location, the maximum distance willing to travel, and what time and day the patient is available. Next, our matching algorithms will automatically match the logistical and clinical needs of the patient with the right provider. And once the right match is found, the patient receives a notification on their phone or email to confirm this new booking possibility. From a provider side, for the first version of our platform, we have created a very simple web-based dashboard, just like Google Calendar, where the secretary or planner from a specific department or clinic can add the listing in seconds with the available slots. On the long term, we plan obviously to integrate directly into the scheduling modules of EPDs so that no separate dashboard is needed. From an insurance perspective, requesting a new slot or managing pending requests can be done also from a dedicated dashboard. From a patient perspective, both the initial request for mediation and the confirmation of the earlier appointment found can be done by their mobile phone, by SMS or email notifications. So for patients, the number one gain of our solution are obviously shorter waiting times for appointments. For insurance, our solution reduces greatly the effort that it takes them today to find an earlier appointment, and it allows them to provide a better experience to their clients. For providers, we enable them to increase the capacity utilization of the departments and to be able to choose which cases they want to focus on based on their clinical expertise. Our go-to-market plan is underpinned on being the first player in the Dutch market with this proposition and on building strong entry barriers by growing the network of partners in two fronts, the demand and supply side of the platform. On the demand side, we're targeting large insurance companies in the Netherlands, some of which we already had several detailed conversations with and who have showed great interest in partnering with us. On the supply side are the providers. And here we are starting by target focus clinics and ZPCs and focus hospitals, peripheral hospitals, who tend to have the highest financial incentive and available capacity to receive these additional patients. In terms of our revenue model, we charge insurance companies a fee per each successful match. To lower the adoption barriers, for now, we are making it free for the providers. Since we started this Rockstar Acceleration program, we have made great progress in our value proposition, and fortunately, this has been very well received in the market. More specifically, we're now at the first stages of collaborating with one of the largest insurance companies in the Netherlands to pilot our solution in the mediation space. So here we will assess the impact of our platform in three key metrics: the number of days of waiting time saved, the number of hours of phone calling reduced, and the percentage of capacity utilization increased in provider schedules. But obviously, this is just a start. So today, this platform works for less complex cases where one just wants to know where X type of case can be done sooner. But in the bigger vision is to help patients, insurance, and referring providers with more complex chronic cases, helping them to navigate the healthcare system in a more efficient way so that the waiting times, costs, and the number of unused appointments are minimized. But also, from a clinical perspective, that we allow that the exact symptoms and diagnosis of a patient can be matched with the right provider. Behind this vision, we have an international and multidisciplinary team of data analysts, physicians, and software engineers. In particular, let me point out Chow, who as a practicing physician here in the Netherlands, brings a first-hand view of this problem. Every day, Chow experiences the inefficiencies caused by appointment cancellations, postponement, and the clinical complications that can arise from delayed medical care. So if you're focused clinics, a ZBC, or a peripheral hospital in the Netherlands, and you are interested in joining our free proof of concept initiative, please contact us. Thank you.